Good evening. Welcome back to the Ask Me Anything with Dr. Twyman. Tonight we have great questions as always. They're submitted ahead of time. If you're joining live and want to ask a question, just drop them in the comments and I'll answer them for you. The housekeeping this week, a few things. You have 4 days left if you're interested in attending the Canyon Ranch retreat in Tucson with myself and a few other my patients from Apollo Cardiology and some of my social media followers. The event is October the 31st through November 2nd at the Tucson Canyon Ranch facility. Outstanding facility. I've been there a couple times before. It is head to toe one of the best wellness facilities in the entire world. They have a great hiking, and that's one of the main reasons I'm going there, to do some training for Kilimanjaro next year. If you're interested in potentially joining me on some of those hikes, some of the breakfast AMAs that we'll be doing, some poolside chats, you have 4 days left. If you go to drtwyman.com/ranch, there's a PDF that has more details about it. I'm not charging any fee to attend. The only fee is the room and board to go attend at the Canyon Ranch itself. Next bit of housekeeping is that I do have a school community, the Heart Attack Proof community. It's just getting off the ground a couple weeks ago, so there's only a few members just there at this point. But I have a lot of content starting to drop in there almost every day. I just dropped one of the videos on my YouTube channel that has a 6-minute summary of my 30 Top podcast. It goes through the real causes of what a heart attack is contributed from. If you're interested in watching that video, go to my YouTube channel. It's there for free, but it was dropped in the school community, previously. So all my newest long-form content is going to initially be in the school community, and then it'll bleed out to the other communities later on. The school community is going to have live AMAs like this, but they can go longer. They'll be more personalized. Instead of thousands of people, there's only going to be whoever joins up in the school community be able to ask me questions. If you're potentially interested in having me review your labs, we can do that. I can't provide medical advice and tell you what medicines or prescriptions or anything to do, but I can give you an idea of what you're dealing with if you want me to use some real data points instead of just talking about hypotheticals. So the school community is live. drtwyman.com/school. You can spell it with the traditional way, SCHOOL, but the school is actually spelled SKOOL. So if you go to drtwyman.com/school, there's a 7-day free trial to check it out. Look at the courses, engage with me in the comments, and if it works for you, hang on. A lot of good AI tools that I've been using lately. It's going to help me really kind of progress with some of the content that I'll be able to put in there to let people know what's the best way to optimize their mitochondrial health as well as their vascular health. So with that being said, we'll jump into the questions tonight. First question up tonight. What are the risks of a heart disease with a level of LDL 3.7 nanomoles per liter and non-HDL 4.3 nanomoles per liter? I'm sorry, off the top of my head, I always forget how to convert the European / Australian metrics into Americanized or Western measurement. So you're going from a volume measurement to a mass measurement. I don't know how to do that off the top of my head, but you have to look at it probably more as the non-HDL being important, because the LDL cholesterol by itself really doesn't predict risk very well. You'd have to look at the LDL particle number or the ApoB. The non-HDL can give you a rough estimate of what your ApoB would be, but typically you want your non-HDL to be only 30 points higher than what your LDL-C goal is. So for most patients who are using the Americanized version, generally want to say non-HDL under 100 milligrams per deciliter. What is the primary indicator of a good endothelial glycocalyx health? There's probably not one, but having elastic arteries through pulse wave velocity is a good way to look at that. Having normal blood pressure, less than 120/80. If you look at biomarkers, having no microalbuminuria on a urine test, having no significant oxidative stress or inflammation, are probably good indicators that you have a healthy glycocalyx. Is there rebound cholesterol synthesis if blocking GI absorption with ezetimibe? At times, yes, that is going to happen. You can look at the cholesterol balance test on the Boston Heart Diagnostics panel to see that happening. If desmosterol and lathosterol levels increase when you're on ezetimibe, then you know that is happening. So if that happens, then you consider using, a statin, deciliter, red yeast rice, or bergamot to start blocking cholesterol synthesis if needed to get you to your ApoB goals. If keeping ApoB under 55, is there any utility in a CT angio or CT coronary calcium score scan? Yes. Lipids don't, tell the whole story. You want to look at the actual arteries. Plaque has many contributors. There's 400 risk factors for plaque, not just lipids. So you want to treat the disease, not the values in your blood. Those just give you a guide point to like what is potentially driving the plaque. What would I do? So starting at age 35, get a CT coronary calcium score. If your score is 0, repeat it every 3 years until it's not 0. If you have a CT angiogram done at any point and you start having evidence of anything greater than 0 total plaque volume, then you want to be much more aggressive with optimizing nitric oxide, your endothelial glycocalyx, markers. That's mostly blood test. Keeping oxidative stress and inflammation down, and then using the tools that we talk about, statins, ezetimibe, PCSK9 inhibitors, Nexletol, to get ApoB to 55, which would put you at the 5th percentile. One more what I do from a lipid standpoint, if ApoB was already less than 55, continuation of prior question, I wouldn't do anything more with lipoproteins if ApoB is less than 55. I would look at the cholesterol balance test and make sure that desmosterol levels weren't under 0.8. When do you know if Arterosil nitric oxide supplements are no longer needed? That would require testing. So you'd have to have a normal endopad, normal pulse wave velocity, normal central blood pressure without those supplements on board, which is not always that common without them. But if you have plaque in the arteries, there's probably no real reason to stop them because they can prevent further plaque progression. And there's data that particularly with Arterosil, there's plaque regression or plaque shrinkage. So generally, if you have plaque, you're not going to stop something that's potentially helping the plaque shrink. And would you repeat an endopad test? Yes, generally every 6 to 12 months. Would repeat it if the previous one was abnormal. If it's normal, then probably every 12 to 18 months. The salivary nitric oxide tests are good checkpoints if you're getting enough nitrates in your diet, so green leafy vegetables and beets, or if you're taking a supplement that supports nitric oxide. Also, somewhat a quick check on your oral microbiome, but they're not the be-all and end-all of healthy arteries, so look more at the endopad and the blood pressure. Would you continue with anti-AFib supplements after an ablation? Generally speaking, depends on what the reason was that you thought the person was having atrial fibrillation. But if you're talking about like the awesome foursome that was previously promoted by Dr. Sinatra, then it's more about do they have other mitochondrial issues that you still would want to use those supplements potentially for. But if the pulmonary vein isolation is successful and there's no significant residual inflammation, then most likely would step back up from those supplementation. If no insulin issues, don't know what this one says. Something about cramps, but I don't know what that means. No musculoskeletal cramps, I guess probably means that. What are the downsides of low dose statin, hormone, or desmosterol? No, not typically. So cholesterol balance test on the Boston Heart Lab panel will look at if you have low desmosterol. If your desmosterol levels are under 1, or particularly under 0.8, the person probably should back off on their dose of statin. There's really no indication that using statins is going to lower testosterone. It's much more about your HDL. The gonads are making their own supply of cholesterol, and so only in times of significant need does HDL deliver more cholesterol to the adrenals and the gonads to make more sex hormones. Can I recommend a more affordable blood pressure monitor besides the Connect QT? Sure. Omron makes a great, model. I, like the one that is the Bluetooth enabled one. That's all one piece. Top of my head, I can't remember which model it is. But it's the Omron bicep cuff that is it's like black, white, and it just fits right over the bicep, and the transmitter sends all the data to the Omron app on your phone. But Omron also makes other ones that are just tabletop models that are good. The only reason I recommend the Connect QT is that it's the best state-of-the-art blood pressure device on the market, and you guys are always asking me for what's the latest and greatest, and that's the latest and greatest. Is it possible to have an allergic reaction to urolithin A? Possible. I don't have any experience with any patients having a side effect from it. So if you've had some type of rash or GI reaction, I'd recommend reaching out directly to the company and informing them of that information. Oh yes, so somebody says evolve. Yeah, thank you, Marlene. So yes, the Omron Evolve is the one that I usually recommend for blood pressure. All right. So somebody must be following me from Allie's post from Silverback. Somebody's talking about testosterone compound cream versus injections, pros and cons on cardiovascular system. That's basically what I'll be talking about at the Silverback Summit in November down in Orlando. So if you want the deep dive for that, potentially attend the event in Orlando. But the quick take home, it's test, don't guess. I'm more of a fan of keeping your testosterone levels in, kind of homeostatic ranges versus kind of blasting and cruising, where you're doing, doses where you get your levels to surge for a few days and then having rock bottom levels right before you dose again. So would lean towards, if creams work for you, it's probably more circadian friendly. I would probably go that route. There's the Traverse trial, which can back you up a little bit from a standpoint of risk. The injections, they are generally safe, but you do have to monitor more frequently because people tend to have more kind of swings in their values. There's potentially more risk for secondary polycythemia. So I will do a lot of testing on patients that come in on hormone replacement therapy. Often you have to look for, do they have sleep apnea? What is their baseline blood pressure before starting testosterone? Then looking at different tests to look at the vascular health. Do they have evidence of plaque in the carotid arteries and the coronary arteries? Do they have other markers in their blood tests that show that they have significant inflammation at baseline? So both potentially work for people, but I would just do the standard screening. Do they have issues with endothelial health? Do they have a lot of inflammation? Do they have dyslipidemia? And start treating those risk factors. All right. So those are the pre-submitted questions. Thank you, guys. So how much do I charge for a CIMT scan? At Apollo Cardiology, it's $200. Do I offer central aortic blood pressure testing in my office? Yes, I've been doing that for about 5 years at Apollo Cardiology. And we have the Aqua device, which is the gold standard at measuring central aortic blood pressure in the office. Don't know exactly what you mean by accurate, but somebody says, how accurate is an LPPLA activity test and an ApoB of 132? So the LPPLA2 activity test, or also known as the plaque test, PLAC test, is a marker of vascular inflammation when it's elevated, often a marker of lipoproteins being deposited into the intima, and this enzyme is being released. So the higher the LPPLA2 activity, the higher risk of plaque formation. An ApoB of 132 would put you well above the 90th percentile, meaning 90% of people would have values lower than you. So think of ApoB as shots on goal, more potential vascular inflammation, more elevation of LPPLA2 activity. All right. So I think I got through all the pre-submitted questions here as well. So the take home today, guys, is, as always, 4 pillars of health. So nutrition. If you want to learn my kind of ideas on Nutrition 2025, that's in my school community, 7-day free trial. Check it out if you like. drtwyman.com/school. Exercise. Well, I haven't done a video on that in a while, so that'll probably be something that I'll release soon. But focus on your zone 2 to optimize your mitochondrial efficiency. Focus on your strength training at least twice a week. Your muscles are your metabolic engines. Stress management. Meditation works for me, but biofeedback, deep breathing exercise, yoga, whatever you need to do to balance your autonomic nervous system and have good heart rate variability. And then the big pillar, the 4th pillar, sleep. You got to optimize it. It's the #1 thing that helps with longevity. I've been using a sleep tracker for 9 years. Yes, it's always in airplane mode, so I'm not getting pinged with EMFs from the device. Sleep scores are generally above 85. So I have no challenges to my sleep for the most part, and I prioritize it. Vascular health, if you go screening, you find things. So it's mostly about optimizing endothelial health, supporting the endothelial glycocalyx if it's disrupted, keeping oxidative stress and inflammation low. You can look at blood testing to figure that part out, and then using whatever tool you need to optimize the person's lipoproteins. If you do those things, you're much more likely to be heart attack proof. So I appreciate your guys' time and attention. I'll be back here next Monday, 6 p.m. Central Time. And if you're still potentially interested or on the fence of attending the retreat at the Canyon Ranch in October, you only got 4 days left. So check out drtwyman.com/ranch if you're still interested in attending some poolside chats, some AMAs, and some hikes with me and a group of people that are like-minded. So have a great time the rest of this week, and see you next time.